Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
In fibroid, patients who have completed the family, in them you can use either uterine artery embolization or magnetic resonance high intensity ultrasonography can be done. Uterine artery embolization is done via the femoral artery using the polyvinyl alcohol, or it is done via the gel foam. And if magnetic resonance imaging, uh, high intensity ultrasound is done, this is done in an MRI room for 2 to 3 hours. Here high intensity ultrasound waves are focused onto the fibroid. The contraindications of magnetic resonance high intensity focused ultrasonography include: the size of the fibroid is more than 10 centimeters, the size of the size of the fibroid is more than 10 centimeters, and it should be more than 24 weeks. It should have obstruction in the path of the rays. If there is any obstruction in the path of the rays, like bowel or foreign body, then it is contraindicated. So magnetic resonance high intensity ultrasound focused ultrasound waves are contraindicated if the size of the fibroid is more than 10 centimeters, with weight more than, with uh, size may be more than 24 weeks, and if there is either bowel or foreign body in its path. Fibroid slowly shrinks in size, and this uterine artery embolization or magnetic resonance high intensity focused ultrasonography is not done in female who is planning to conceive in the future.
thank you and thank you for watching.